Hello and welcome again to the Holon IQ 2022 Global Impact Summit. My name is Vernon Baxter. I'm the VP of Health at Holon IQ. As part of our Africa Summit, I'm delighted to be joined by Daisy Isiahu, who's the co-founder of Zury Health. Welcome, Daisy.
Thank you, Vernon.
Thank you. And just to set a little bit of context before we dive into today's session, firstly, we're going to be talking to Daisy about her business, Zury Health, which she's the co-founder of, and to learn a bit more about where the business has come from and what are the problems it's trying to solve. And then we're going to talk more generally about the African healthcare landscape and how it might compare to some of the other geographies that we're covering as part of our global summit. And then we're going to have a little bit of a discussion about what the future holds for healthcare across the African continent. But first, Daisy, I'd love to hear from you about where the idea for Zury Health came from and what really was the origin of the business and really what were the kind of problems it was focused on addressing in the system.
All right. Thank you so much, Vernon. I'm always excited to share about what you're building at Zury Health. So our journey at Zury Health started with a vision, and that is a vision to provide quality, affordable, and accessible healthcare solution for all with a simple swipe. And this is because millions of people in Africa do not have access to basic, affordable healthcare. Sub-Saharan Africa, for example, bears the highest disease burden in the world, with slow and limited access to medical healthcare, expensive and inconvenient hospital trips for small or minor prescriptions, and unequal distribution of healthcare services. So we see that most of the healthcare service providers are highly concentrated in urban cities, leaving out the people who live in the rural areas. The doctor-to-patient ratio in Africa, for example, is 1 to 5,000. So what happened is, due to the pandemic, at Zury Health, we took that time to build a solution that will fill this gap by digitally connecting patients to healthcare service providers and ensuring that they're getting access to affordable healthcare. In this way, we are able to democratize access to healthcare in Africa. And this is because we saw, a huge market opportunity where virtual consultations were now emerging as the most convenient way for doctor and patient interaction. So what we built at Zury Health, we built through available digital solutions, we are able to link patients and provide them access to quality medical healthcare via a mobile app, a website, a WhatsApp chatbot, and also SMS service. So through the app and WhatsApp chatbot, patients can chat and consult with doctors. They can buy medication from a pharmacy, have it delivered to their doorstep. They can even book labs and diagnostic tests and request for doctor at-home visits. We also took into cognizance Africa's unique challenges because we understand that over 60% of mobile phone users do not have access to smartphones. So we rolled out our SMS solution service to provide first-level medical consultation via text so that people can be able to chat and consult with doctors from as less as 10 cents. Very, very affordable, and they're built from the airtime. So this way, we're working with available partners, and these are certified doctors, pharmacies, and labs and diagnostic centers, including Telcos. We're able to provide these services effectively and efficiently.
And Daisy, it'd be interesting to hear more about the relationship between telcos in Africa and the population and in particular how it relates to healthcare. So I know at Zury Health that a large part of your strategy involves partnering with telcos across different regions. Maybe that you could expand a bit on that and sort of provide a bit more context on how that works.
Yes, so our strategy to scale is partnership through telcos. We currently have over 16 telco partners, and this is because of our SMS service. We understand that Africa is widely a vast market. For instance, in Kenya, most of the people are subscribed to caller back ringtones. We have the M-Pesa payment option, and people find it easy to chat and subscribe to these services. So with telcos, we are able to ride on their trust equity because most people trust the telcos more. We say that the telcos know you more than your bank. They know you more than your spouse. So they understand your spending pattern and they're able to understand how much can Daisy recharge, what is the, how much am I able to afford a service? So we see that when we ride on the trust equity and the fact that telcos have a wide subscriber base for mass marketing, it is very, very easy to scale and to scale faster when you partner with telcos. So if you plug in telcos because they already have these subscribers, it's easy for you to reach the end users and majority of all mobile phone users.
And maybe if we could just focus on the capability of SMS in being able to sort of, I suppose, help deliver healthcare services or help put patients in correspondence with doctors. I mean, could you maybe tell us a bit about, I suppose, the positive elements of that? But presumably there must also be limitations and challenges because you don't have the same data bandwidth. Obviously there's a whole world of reasons why the world doesn't just function on SMS. How does that kind of impact from a healthcare standpoint?
Okay, so we flipped the VAS model to include healthcare, and we see a huge impact to the SMS service, and it's mainly accredited to the cost factor. So the fact that it's very, very cheap and you're billed from your airtime, most users find it easy to use, such that I'm able to just chat to the doctor responds within 3 minutes, and it's not a bot. So the fact that I'm able to chat, be billed from my airtime without providing external bank cards details and payment methods, it's very, very efficient. And why we see this as a very popular model is because of also the anonymity factor. So currently we've been able to handle multiple engagements of the SMS service, and it's very, very popular among the young women, people who live in the rural underserved communities with no access to smartphones or the internet. And they're able to engage even about their sexual health related questions. So they don't face stigma. So no one can can profile them, because what we see is in some communities you can find that within the community there's only one doctor or two doctors. So it's the same doctor that even when you go to the same probably church, you visit the same social centers, they know you. So just to avoid that stigma that comes with these doctors knows all about my health conditions and everything, we find it very, very popular among people, and we are able to provide this across different areas in Africa. So even if you live in Turkana parts of Kenya, in Isiolo, in the really deep underserved communities, you're still able to access these services. And highly because the SMS service factors and focuses mainly on preventive healthcare. So we see that it's very, very easy, because if someone is able to understand their condition earlier enough, they're able to use and apply measures to prevent serious future healthcare conditions or chronic conditions from recurring. Because a lot of currently the government focuses on curative care, but we need to focus more on preventive health. And what COVID taught us is when you're early prepared, you're easily able to curb future pandemics. So this is highly effective, and we see that even the mobile penetration itself in Africa is over 100. So each household at least owns a mobile phone, and it's very, very accessible. What differentiates us is we see a lot of health tech companies only providing app solutions. So this leaves out a lot of people who don't have smartphones, and it only targets people who already have probably health insurance, they live in urban cities, or are only looking for convenience. But we actually are targeting even the low-hanging fruits in the society.
Yeah, I'm interested on that point around how you configure your business in terms of price point, potential market, and you made that point earlier that the urban centers of Africa are typically where there is concentration of healthcare provision and access to services, where due to the vastness of other parts of the continent, it's very difficult to physically sort of have that infrastructure. Maybe it'd be good to understand more, Daisy, when you started the business and you looked at this market, how you went about deciding on a pricing strategy where I suppose you have to consider profitability versus market opportunity, I suppose.
So the reason why, one thing I credit this to my co-founder, who has over 12 years working experience with telcos. So he understands the VAS model, how you're able to, flip the VAS model and provide healthcare, including health tips. So it's also an educative channel. So in terms of scalability, it's very, very easy to scale because you're able to roll out different products, and it can easily be efficient because you only require minimum amount of doctors who are available on shifts to provide these services. So even how we work at Zury Health, we are utilizing we call it uh, unutilized inventory. So
Yep.
we have a lot of doctors who actually want to earn extra income because a lot of doctors in Africa are underpaid. Most of them don't want to go and set up in rural areas because of poor infrastructure or insecurity. So just for them to have extra income and provide schedules and provide these services, they're still able to provide these services via SMS service. So it's very easy because how we partner with telcos, it's through revenue share model. So it's also a benefit to the telcos, and they're able to earn more subscribers. Currently as well, with the telcos, we are able to roll out more products, including the lending, because it has been efficiently tested even in the Kenyan market, where you can actually be lend airtime to get these services. So we want to flip this model where we are able to lend people airtime or money for their healthcare needs so that we can ensure that most of the community or most of the members have health insurance cover, which is in line with what the government is trying to achieve to get most of the citizens having a national cover. Because what we see, even the insurance cover in Africa is only less than 3%. So there's a big gap and a big margin, and we're working hand in hand to provide these services. Also with the telcos, they don't want just to get they don't want to focus on airtime billing for their subscribers. They also want to provide more value added service to their customers and also drive data driven options. So the fact that we are still able to utilize and flip these SMS service users into app users and WhatsApp bot users, they're still able to utilize the data aspect of their model and services.
Sure, that makes a lot of sense, and I think that'd be an interesting opportunity to talk, I suppose, about the wider health tech innovation landscape. I mean, obviously you're on the front line of building a business in this market and working across multiple geographies. How would you characterize I suppose, both the direct competitor landscape, but also the other businesses that are working in complementary areas and bringing other solutions to the marketplace? Do you feel that it's quite a vibrant place to be at the moment?
Oh, yes. I mean, so what happened is COVID exposed the underbelly of the healthcare challenges. And we even saw big nations and countries like states having the challenge to solve this problem. So it was a universal problem. And what we see is there's a huge opportunity in the healthcare space, and we need to work together in partnership. So, and as much as we have other people or startups doing the same thing as Zury Health, we find that they're not necessarily competitors because we are all working towards the same vision and mission. And what we do is we actually plug them in. So you'll find that we've partnered with different companies that provide these same services to be able to distribute these services into the other markets, because healthcare is highly fragmented. So if I'm providing this service in Kenyan market and I already have someone else doing the same or applying the same solution in Tunisia, in Morocco, in Ghana, in Chad, it's all a matter of plugging in and just working together, because we need to solve this healthcare solution. And what we see is, so at Zury Health, we built a super health app. We see most of other providers with unimodal solutions. So they only either focus on telemed solution or service or e-pharmacy. But just to, no one wants to have 5 different apps on their phone just to have their healthcare needs met. You don't want to have one app for telemedicine, another one for booking your pharmacy or lab tests. So how we've been able to roll out Zury Health is we want our users to journey to start and end in the app. So be it if you chat with the doctor and after completion you have a prescription, or the doctor requests that you do different lab tests, within the same application you're able to navigate to the pharmacy section, upload your prescription, order for both over-the-counter or prescription medication, order for lab tests. Someone comes to your house, picks up your sample without you actually going to the hospital. So we are also decongesting the hospitals, where we find that sometimes because we have very, very few healthcare centers, there's a lot of congestion. And these are some of the things that we try to solve. And the fact that we know that most solutions are app-based, we also know that, and this we see because we host very numerous free medical health camps in different parts of Kenya parts of Kenya. So we've seen that most people who come and visit us on the medical camps, they don't have, they're only working on feature phones. They don't have smartphones. And most of them are the elderly. They're not versed with the growing technology, and they're used to just sending messages and text. So this is how our approach towards democratizing access to healthcare in Africa is step by step, and just growing and riding on the available digital rails.
And Daisy, it'd be interesting to learn more about the cross-border element of both your business, but for anyone really trying to make an impact across Africa in terms of healthcare. I mean, with digital in particular, in many markets, regulation of digital is complex and can be controversial in terms of how accountability and quality is ensured throughout a system. What is it like working across multiple different countries and different regulatory frameworks and different levels of interaction with government? How do you approach that?
Yeah, so it's true. Healthcare in Africa is either highly regulated or under-regulated. And that's the biggest challenge towards scaling in Africa. But how we've built our solution is we've been able to de-risk our business such that we are not just relying on a unimodal solution. So if we can roll out with the different MVPs, if we launch in, because it's very hard to, for instance, in Francophone market, they have like really, blocking regulations towards providing pharmacies. So you can only, as a pharmacist, you can only provide medication within a specific area. So for that instance, we can still ride and work on the telemedicine without necessarily, having the blocker. But also, just to note, it's one of the ways we've been able to build out. We have to ensure that we abide by all the regulations for specific markets. So for the different markets, we have been able to geolocate. So doctors in Kenya or healthcare service providers in a specific market can only provide this healthcare solution for people in that market. So for the Nigerian doctors, they can only see and receive bookings from patients who are based in Nigeria. Same applies to Kenya, Zambia, and Senegal as well.
And I understand that this won't be possible in every circumstances and every geography, but have you thought in terms of how you are able to measure, I suppose, outcomes and measure impact of the services? And, obviously with healthcare, there's always issues of data confidentiality and what is disclosed. But one, potential positive of a greater digitization across the system is the ability to measure outcomes and impact and track progress. And to what extent is your business configured to be able to do that?
Yeah, so in terms of our business, we ensure that our systems are end-to-end encrypted to meet the Data Protection Act regarding healthcare. But also how we measure impact is according to the number of services and the feedbacks we get from our users. Currently, we have over 500,000 SMA subscribers and users who have active engagements with doctors. So we see this impact where we are able to provide these services, and we are also measuring recurring customers and clients who come on board, and just from the feedback that we get from our patients. So how we measure impact is number of orders that we get, the number of engagements, doctor-to-patient engagements that we get, and the number of bookings and sales. So this way we're able to know how much we're able to provide. We can get information as to where these users are, where are they best, their demographics, are they, and the kind of questions they highly ask. So these are some of the things that we can be able to measure and even partner with government organizations, because we have a lot of data and we want to see how we can utilize this data to be able to provide, candid information on what is happening. So if we see that there's a big problem in terms of the mental health cases, the sexual health, reproductive cases, gastritic cases, we're able to, work with the key policymakers to ensure that these issues are looked into and resolved.
Thanks, Daisy. I think before we sort of look to the future and talk about the ways in which the market might evolve over the kind of mid to long term, I'd really like to kind of hear a little bit more about what the last couple of years has been like for Africa in terms of the experience of the pandemic. Our series is a global one, and we're obviously having different geographies have had very differing experiences of that period of time. But maybe you could briefly share what the experience was like. I used a phrase earlier that it exposed the underbelly of healthcare systems, and I'm sure that a lot of people globally will be sympathetic to that experience. But maybe you could share a bit more.
So what we see is COVID actually provided a shift in mindset even to the investors who had, a clear focus to fintech solutions, leaving out the health tech solutions. So everyone now saw the need as to why it's important to actually have these solutions in the markets and scaling faster. So we even see health tech solutions now adapting to the challenges that COVID brought in terms of even distribution. How are you able to distribute different medical products from kits, vaccination kits and whatnot? So we see a high and huge shifts where we see health tech was now given the importance, and now people understood why there's a huge need to make health. Sorry.
Yeah.
My internet is so unstable.
No problem. I think if you just have another go at finishing that sentence, and then we'll be able to edit around it.
Okay. So it actually validated a lot of health tech startups. And now we see that a lot of investors are being keen on available health tech solutions because we're providing a lot of solutions that could be solved that no one would see. People used to think that health tech startups are only, for impact, social impact, and not profitable businesses. But right now, we've been innovative enough to be able to provide these services and still generate revenue to provide a sustainable healthcare business and solution.
Thank you, Daisy. Well, I'd just like to finish by asking you to share a couple of thoughts on what the future holds for the health tech market. Obviously, with your own business and its focus, it's a really exciting time for you personally. But if you were to take a step back and think of how the market might change and evolve over, let's say, the mid to long term. So if you were to think 20 years, 30 years down the line, how would you like to envision what Africa healthcare might resemble over that kind of period? How optimistic are you for the future?
Well, so for the future, I see that each household, each person will be able to at least afford the basic healthcare services. And the fact that we're actually building and growing towards democratizing access, we'll see a lot of people now adapting to virtual consultations, the digital models, and we'll have very, very few people actually going to the hospital for serious medical conditions that only need emergency services. So I see the future of healthcare driven by tech and available digital solutions, and we see a lot of people being empowered, a lot of people having businesses because of the available tech solutions, and I just see a tremendous growth. So we see a big uptake towards the services and solutions that we provide.
Well, thank you, Daisy. I found it fascinating today, and I really appreciate you sharing with our audience your experience of both Zury Health and the wider African market. It's a fascinating time and a fascinating business. So thank you very much for your time today.
Thank you so much, Vernon. Thank you for having me.